Welcome, David, to the Behind the Practice podcast. I really appreciate your time today.
Thank you, Jeff. It's a real honour. I'm really humbled to be here and invited onto your program. Excited to have that chat. Let's go.
Fantastic. That's awesome. I was listening to one of your recent podcasts, and definitely there was a lot of interesting points that I would love to touch on. For those, I guess, that are not familiar with you, can you please just introduce yourself, share a bit about what you do, and yeah, we can dive in.
Okay, I guess for those people who might have heard of me or know of me, in simple terms, I'm just your regular traditional chartered accountant, but I just happen to specialise in the healthcare industry. But we do a few other things, and I'd like to think, from a personal point of view, I see myself as a provider and a patient advocate. So I'm very, very passionate about providing and helping our clients provide high quality, sustainable healthcare services. But we do other things. We're actually involved, and we have some special software, which if you want to talk about that, we can talk about that later, called the Doctor's Pay Calculator, which is basically a clinical and regulatory pathway compliance tool to help practices just keep up with the myriad of regulations and crossing your T's and dotting your I's, whether you're fearing a tax audit or a HIC audit or any other type of audit, where we do things properly. So then, practitioners can then start focusing and keep focus on their patients and not let bureaucracy pull them down and discourage them from having useful and meaningful relationships with their patients and work well within the healthcare system and with other practitioners and their colleagues. So that's who we are, and that's why we do what we do.
I definitely, I guess we can start there, to be honest. You were one of the first ones to raise concerns about the payroll tax crisis. And at
Yes.
the time, many in the industry dismissed that warning in itself. I guess now those concerns have become a reality. I guess what's your thoughts on that, in terms of the major medical associations, the policymakers, who should be held accountable? I guess, can you, from your perspective, talk a bit about that?
Okay, well, to bring some context into that, I mean, I've been in this industry. My practice I set up in 1992. I've worked all over Australia. Some kind drug companies called AstraZeneca and Pfizer's got me involved in doing GST presentations back in 2000. So I was doing a lot of work across Australia, and had worked, face to face, not at a political level, just helping practices become compliant with their business models back then. So a lot of there's a certain generation that know who I am, and there's a new generation that are learning to know who I am, maybe more through print media or digital media moving forward. But what it did, it gave me a very unique insight, and I've been an AgPal surveyor for 10 years at the time, so I knew how to sign and sign off on a Bowie Dick test as much as sign on your tax returns. That I was very much really interested in the anatomy of, particularly in general practice, on, what is this model? What is the business model? How does it work? How does it relate to patients and the community at large? And to get it right, because I'm a big, ethics is very important as far as I'm concerned. I mean, as soon as you lose people's trust, you go bust. It's that simple. And it only takes one word, one sentence, and it's over for everyone. And particularly what I found in the medical profession is they like to talk to their own, and sometimes that's a good thing. And sometimes there are some that like to get external advice, and there's others that say, look, I don't need to, I'm smart enough, I can do it myself. And I think that's where things start to unravel, and that's what's happened certainly with the payroll tax issue. My accountant's better than your accountant, my lawyer's better than your lawyer. Look, I know what I'm doing. I have a 6-figure salary, and we've got 10 clinics, so we must be right, or the listed companies do it, and we do this whole copycat thing without actually even looking at the detail, and that's what's happened. And what I noticed back then is that general practices and medical practices and healthcare practices were all set up in more of a traditional way, where they had what are called service entity arrangements, and doctors paid a percentage of gross fees, and they used to advertise themselves on their own, and they would share the back office, right? But what happened, corporates came in and said, hey, here's a lump sum payment, here's $500,000. And then they started rebranding the whole thing, and they changed the nature and the purpose of those entities into becoming what are called medical centres. And then the tax office started looking and saying, well, hang on, why are you telling these doctors on how many patients they can and can't see, or when they can work after hours? Why do you have all these restraints? Hang on, you're treating these people more like contractors, or these contractors are more like your employees. And suddenly, what was clearly black and white back in the 90s turned into shades of grey with the advent of corporatisation. And because they were big corporates, everybody would listen to them. Well, David, who are you, or any other firm? We're a big listed company on the stock exchange. We must be right. And at the time, the tax office, they'd only put in the the laws for the GST, and we'd all assume that, well, surely the tax office or the accountant would have said something. But the reality is the tax office and the accountants didn't know anything, because nobody was checking anybody until in recent times, where through digitization, the tax and laws have been passed to suddenly we can now data match. Suddenly it becomes a lot easier to audit people from the desk. You don't have to physically go in and do a desk audit. And then suddenly these prosecutions started, and suddenly, particularly the Revenue Office, and this is probably where my experience started for my first payroll tax audit back in 2014. And, they start asking all these questions and going, well, who's reviewing the medical billings, and why are they doing it? I thought it was a service entity, or, what's going on with these banks and these funds flows? And they said, you know what? It looks like a duck, it sounds like a duck. Guess what? These doctors are really employee-like contractors. Bang, payroll tax, smack, needs to be applied on this. And then, well, the rest is history. We know that, and the college has made big noise in the AMA about how unfair this is. What has never changed is the laws. And that's since 1978, these laws have never changed. The only thing that's changed is the enforcement of those laws. And so when the enforcement, and let's be honest, it's human nature. Nobody does anything unless somebody's getting prosecuted, unless it's in my back garden, or it's in somebody else's back garden, somebody who I trust and respect. Do I even start to take notice? So people like me, who are probably sticklers for detail, some people thought, oh, maybe he's too expensive and no other accountant's doing it. And so he's just basically the cynicism, the skepticism, he's just trying to make money, trying to sell a calculator, whatever it is, kind of tends to lead the narrative versus saying, why is this problem occurring? And actually people looking in deeper. And the reality is the tax office is the one that's brought it to a head, simply because it wasn't just happening in one or two practices, it's rampant across Australia. And that became very self-evident when the college and the AMA started going on to the 6 o'clock news, which I told them, privately as well. One thing you don't do when it comes to the tax office is try and embarrass them. It just never works. It never ends well. And when you start asking for exemptions or different rules that a certain group is entitled to tax breaks that the rest of us aren't, it's never going to end well. They might do some temporary things, but if it's basically jarring the fundamental commercial and legal principles of how our society runs and operates, you get blowback. And that's what's really happening now. So you might have thought you won the battle here, but really you've really lost the war, I think, because it's so politically visible, this whole payroll tax issue, and patients now being hit with a payroll tax fee. I think we're about to see a lot worse is to come, unless people start pivoting the way they're actually doing and ratifying and understanding, look, what business are we in? Are we in the business of actually selling medical services? Is that a good business? And if that's the case, there are payroll tax implications. You're then going to have to suddenly pay super. Suddenly the doctors on a 70-30 split have to charge you 10% GST on that 70, or return back to basics, back in the 90s, back to the future, and go back to that administration service support model and say, we're here to support the practitioners, give them the freedom and responsibility they want, making it more of a user pay system. So if they want to work after hours, that's fine, but they might pay a higher service fee, or you could do a better deal if they are going to give you more sessions and rent it out like a typical landlord tenant arrangement. And that way you don't have these payroll tax problems. You don't actually have any of these problems that we speak of. And in a funny way, I see the future when people start to understand and they find lawyers and accountants. Now you say, who's to blame? No, I don't blame the college. I don't blame the AMA. I don't blame practitioners or practice managers. Who I blame are the legal and accounting profession. It's our responsibility. I've probably spent my weekends, days and nights reading thousands of pages of case law, asking the questions, and it's more important to ask the right questions and get the right popular answer. That's not how decisions are made. I tell you what's popular, nobody pays tax. I would get elected prime minister and I'd be on the front page of the news. But that's not the way our democracy and society works. Who's going to pay for the judges and the lawyers and the cops, and who's going to pay for Medicare? So we live in an ecosystem. And I think that's the thing, is we don't take this top-down view, and I did, not just bottom-up. And what I try and do is reconcile the two and put it into some practical and useful advice. And then, and if we've got templates and software to try and help that make it easier, only because it just protects patients and also the practitioners and the owners just from these unintended consequences. I think they will mean well, but I think at the end of the day, it's a bit of a home goal at this point. And practitioners are now getting these bills. I guess that's the only time people start to take action, is when you get a bill. So it wouldn't matter how much, you can scream, I think I've been called Chicken Little, David Dahm, a whole range of things. But I didn't create these laws. I'm just the messenger. And sadly, people take a position, well, it's just easier just to attack somebody's credibility rather than listen to what they have to say, which is probably not the most mature approach. But what is now happening, because it's now costing them money, there's been a more mature appreciation of what was being said. But none of it was new. I think there's just been a fair bit of naivety, a fair bit of populist sort of opinions going around, rather than really looking and digging deep and looking at those details. And I was quite exasperated in the end, to be quite honest. And you would have probably read media reports. I submitted a 262-page ruling on all our work, all our IP, about $4 million worth of stuff, and submitted the tax office to all the SROs and the Prime Minister and the opposition leader and the health ministers, saying, look, we do have an existential crisis, but we also don't. I don't think we have to change any laws. I think we need better education of practice owners on how to set up and run their structures, and then it becomes a choice on whether they're compliant or not. And I don't think, I hate saying this, it is a storm in a teacup. If you pay a little bit of money, you're going to get a much bigger return than doing this current trajectory and this current narrative of asking tax exemptions here and always lobbying government, because it's tax laws are very complex. They're driven by courts and well-established legal principles. And you can't just sit there and just demand I need it to be tax-free, because I just think it's not fair. You do need to consider everyone else, all other taxpayers who might not be doctors. We all save each other's lives. You do great work. I do great work. We all impact on the very people who are saving people's lives. So I don't think anybody's got that monopoly of being the only people in the room that are actually saving people's lives. If people want to use that as some sort of rationale to claim a tax exemption, maybe I deserve a tax exemption, so do you. How far do you draw that line is what I'm questioning, and I'm saying let's just stick to the rules and keep it simple, and maybe try and understand more what's going on.
How do you handle the praise and the criticism that comes from your insights?
How do I handle it?
Yeah.
You kind of get used to it after a while, and I guess I look at the person, I go, okay, who's criticizing me? Have they ever met me? Have they ever read my work? Is it just because they don't like it because I'm in the newspaper and they've got some sort of problem with me being in the newspaper? And that's a different kind of issue, and I can't solve that. I guess some people have mentioned it might be an ego problem, but I'm not here for ego. I'm just here to get a job done. I'm sorry, I'm disappointing people, and I'm trying to save people from. I mean, I'm sitting and I'm watching people's family life fortunes being liquidated because of the tax department. I work in litigation. And that's what I see. And then I see communities losing doctors. And to me, that's the real damage. So for the one person who wants to make some sort of, I guess, flippant vanity metrics type of comment, I know what I'm doing. I'm trying to keep those practices in business who want to do the right thing the right way. And to me, those criticisms are just, I don't let them bother me. It's not nice. I won't get you wrong. And I would hope educated people, and I guess that's the other side of it. You can you can have an education. It doesn't mean you're really educated um, on the practicalities of life. And part of being, I think, a good professional person, with a doctor, lawyer, accountant, practice manager, is being open-minded, hearing both sides of the story, rather than just being gaslighting somebody's name or reputation. And I feel sorry for them, because it means they've got bigger and deeper problems than I've got. And there's a whole group of us the silent majority who just want to get the job done. And I think that focus is probably more important, more useful, and maybe don't play the person and play the process, which is where I'm at. And I tend to listen and respect people when I get it wrong. I am more than happy to hear that criticism. It's so important, self-reflection, and that's probably how I keep my sanity going. And if they make a good point, and that's one of the reasons why I publish, people say, oh, he does it for publicity. No, I leave it for everybody to criticize me, including the tax department. I mean, they're on my email list. So I'm not playing secrets here. I'm very open, very transparent, and I want to learn. I'm a keen learner. I'm hungry to learn, because I know it's going to help people in the long run. So I play a long game. I play chess, not checkers, and I know a lot of my critics play checkers. It's just, and after a while they do go away, and sometimes to stop them, you call them out, and then they go a little bit quiet on you, and away you go forward. But yes, it has been something that does come from time to time. I know I had that with pathology rents. People were getting excited with me when it was the GST. People were saying, oh, the GST is not going to happen. I'm going, dude, these things are happening, whether you accept it or not. Then they say, oh my God, you're like Nostradamus. You predicted it. I said, I'm not special. It was there. You just didn't choose to acknowledge it for yourself and how it was going to impact yourself. But it's not for me to school you on that. The tax office or the regulator will touch you on the shoulder and remind you of that. I don't need to. I'm just trying to, as I say, be the messenger to a very crucial and critical message.
I like the open-minded comment. Definitely in terms of in our industry specifically, in terms of being open-minded, and it's so broad. So I guess the room for collaboration is massive and
Mm.
partnership. So you've worked with over 1,200 medical professionals. What have you learned about leadership and collaboration through these partnerships?
Um, Good, bad, and the ugly. Um, I think the good side is everybody's very well intended. Um,
Yeah.
um, um,
Everyone's trying to fix the solution. Everyone's trying to help.
yeah, everyone's trying to help, right? The bad is that we're so busy that we'll make a whole thousand excuses, and to save a penny, we're losing a pound, and
Mhm.
we don't spend enough time self-reflecting, I guess. Um, those that do exceptionally well and it's solid. Um, and I guess the ugly is when I say it's ego and ignorance that are our biggest mistakes we make, and particularly when that ego you know, checks in, and you have poor governance, and people don't put things in writing, and it's all just hearsay, and it almost becomes like a schoolyard, bunch of schoolyard kids arguing about stuff. I find that the disappointing side of healthcare, because it can get very, very petty. I've seen specialists argue with each other, or GPs to specialists, and who's more important, the bigger person in the room, who should get paid more. I'm going, is that what's really, really important? What about what you're doing? Are you providing value to the patient? Are you providing value to the community? Do you want to do that? Do you even want to be here? Like, why did you check in to become a doctor, or why did you check in to be, a dentist or an allied health worker? I think those questions need to be answered first. And I wish people probably spent more time on that issue, and then engage on this. I want to, have my own business, or be an employee, or be a tenant doctor, or become an owner of a practice. So they have a clear personal vision that when things get tough, they're going to stick it out, and the pain of getting it wrong, they'll stick it out because they do it because they really care about what they're doing. And I think, I'd like to see more of that, and less more of the blame game, and more talk about what you can control and not what you can't. And YouTube, fantastic. Social media is fantastic. There's so many free online resources that people can use, like even today with great practice tips and stuff. Perplexity, these things are gold. You can background check people in seconds. It wasn't like that back in my day. I'm sorry, but I'm pre-internet, right? You had to sit there and meet people face to face, right? These days, all you have to do is poke and swipe left and right on people. It's so easy to get in touch, and you guys complain how hard it is. I mean, I'm sitting here and we're having this wonderful conversation that people wouldn't even look at the Zoom before COVID, you know? But
Mm.
now we're doing so much more. So I think it's a world of a lot of opportunity. Okay. It's not this, I'm sorry, there is no GP crisis. There might be a mental GP crisis, and that's a state of mind, but there is no GP crisis. It's a crisis of a mindset, is what we have. And I think if we get the right, healthy leadership mindset, nobody wants to join the Titanic. You can't sell tickets to the Titanic. And if the leadership keeps saying it's terrible, and you wonder why people don't want to join, well, look at yourself first. Look at your message. And my message is, it's not that bad. there are so many other people doing it a lot tougher in this country, and they really need our help, all of our help. And that's where I say, start with the right vision, work out what you really care about and focus on that. And that's what I'd like people to do. But understand it's not just about building an item 23. It goes beyond that. It goes beyond the consulting where you have to look at the entire ecosystem and structure, and you have to have a multi-view, and you have to use all your advisors and consultants, in the right way. I don't think anybody, including us, has a monopoly on that answer. But there are some people that are more experienced, and you don't have to kind of reinvent the wheel, and it doesn't have to be the end of the world kind of stuff. And I think that's too much of that. I'm a victim versus I'm empowered, and I can take this to the next level because I can at least speak to people who are in the low to get a head start, people like yourselves. I think we'll have a lot to add to each other and can do a lot better. And I think that's probably what I'd like to see is a bit more collaboration and done with consultation.
I definitely want to touch on the mission. I think everyone needs their own mission, have their own set of values that they follow and abide. In terms of with your mission and how I guess you started within healthcare, it's more focused around sustainability for general practice, or in terms of business. I understand that a life-changing. I would love to touch on a personal story in terms of how you actually got into healthcare, and I do understand that a life-changing car accident back in '89, I think it was, played a significant role in shaping your perspective in terms of in health and that catalyst for your mission. I would love to for you to share that story and touch on that.
Okay. Well, I'm making full disclosure here. I never wanted to be in healthcare. It was the least thing on my mind. And I had a very educated understanding of why I didn't want to be in healthcare because my father was a doctor and my in-laws are all doctors. I'm surrounded by doctors and OTs and allied health and physios and psychologists, the whole gamut. And that's the last thing I wanted to be. So what did I do? I went and joined one of those big four accounting firms. Right? These are all rock star Ivy League firms that you join. There's four of them, and the masters of the universe. And I had the best job offers at the time. And the only problem in those firms, which sounds familiar, in the GP world, you work long hours. You don't get paid a hell of a lot, and you work a lot of long hours at the time. And I was no different. But I was very enthusiastic, and I wanted to learn. And I learned a lot of really good things, and I also learned a lot of things that probably I wasn't so crazy about. But one thing that happened was one night I was working very, very long hours on a Tuesday night, and I crashed my car at 5:30 in the morning and wrapped myself around a tree. And my face hit the window, and it was quite a significant accident. The car was written off, and because it was a Volvo, so I'm a live crash-proof test dummy, the engine actually went under the fireplate. So I live to tell this story. But at that time, because here I wanted to be the guy who was working on Wall Street, and now I'm working for the man and the woman on the street, that's when I had my aha moment going, gee, helping all these rich cats and these high-profile clients, make money and then shift it offshore and don't pay any tax and do some really interesting stuff that maybe for the rest of us, you blush. I didn't find it probably the environment, it was legal, but probably not the ethical environment that I was probably expecting to be in at the time. And plus, we had a big bank that collapsed, and I was on that job, um, and that sent South Australia bankrupt for many, many decades. We only finished paying it. Now we've got to bail out Whyalla now. The Prime Minister made an announcement today, so we've got State Bank 2 on our plate. I had a real issue with governance, let's just say. But more importantly, when I was in the car, the first responders came, the AMBOs came, and they were sort of asking me all these questions, and I was pretty tired, let's be honest. And they started cutting up my brand new Country Road suit at the time, which was a lot of money back in the day when Country Road was coming up. It was very expensive gear, needed to look the part. And I was pretty upset about that, to be quite honest, even though I was coming in and out of consciousness. But what actually happened to me is they kept asking me all these questions. So what's your name? What drugs are you on? When was it, have you had any injuries? And I'm going, why do I have to keep answering these questions? I mean, if that was information was on my credit card, ironically, my health record, I wouldn't have to keep answering these questions because I can't even remember what pills I'm on. Even today, I wouldn't be able to tell you I'm only on one thing there, but how many milligrams am I on and when's the last time I took it? And so, but when I was in the hospital recovering from my nine operations that I'd had subsequent to that, I just said to myself, God, there's got to be more to life than making money. And I said, who cares if you got all the money if you can't enjoy it with your family and your friends, and you can't go on holidays and trips, and it didn't make sense. So I guess at a very young age, I was only in my 20s actually at the time, 1989. Yeah, I was 21 at the time. And because I met so many wonderful doctors and healthcare workers that helped me rehabilitate myself, I said, I got to do something that has a sense of purpose and that was actually useful and meaningful. And what I learned, even back then, I was complaining about the healthcare system, but I realized it wasn't the doctors and the nurses, and that was great care back then, but there was just so many problems with the system. In terms of patient engagement, we don't even know who the doctors are operating on us. We don't even know why they're operating on us. We don't even know what they do. I mean, I had a colorectal surgeon doing an assessment on my knee, and I didn't have any colorectal problems. And I only found that 2 or 3 years later because I bumped into a practice manager when I got into the healthcare industry. Said, but your husband's an orthopedic surgeon? No. I'm going, wow. So, I guess that kind of raised my curiosity about how the healthcare system worked. It was a lot of money, a lot of people, and people obviously, being a young person, it was probably the best thing that happened to me because that set a focus that, I would have hated to have that car accident today when I'm 50 going, shit, I could have spent my, and so that was my big life-changing moment. So I'm really committed into empowering patients and practitioners to not have a middleman, not have an accountant. I'm sorry, and I'm an accountant, to be interfering in our care. And the college supports me on that because they ran a high court case back in 1980 on this, that the doctor-patient relationship was sacrosanct. The High Court Chief Justice Gibbs made that comment. And I really believe in that, and that needs to be protected and preserved. And that's basically what I maybe found my calling to being. We all want good, high quality care, and we want to be in a trusting relationship. We don't want to feel like, oh, that doctor is basically doing that extra operation on me to pay off his this month's Maserati bill, right? I don't, and that's where I see healthcare going a little bit funny in some places. Look, I don't begrudge anybody making money, risk and return. But when you are starting to live outside what you call your overcapitalized lifestyle, trophy house, trophy spouse, cars and holidays, that is actually impacting patient care. And that's why you see the odd doctor get caught up in a Medicare audit and stuff. There usually are other financial things from experience that are actually driving sort of a certain type of what's called provider behavior, which obviously now, the government's looking in and saying, hey, that's not sustainable. And where are your clinical standards? Are they peer reviewed? Or do you guys all make it up? And we even went to Parliament on these issues. I was involved in a Medicare audit many, many years ago when, all the patients wanted basically a female doctor. And then within 12 months, my tears and smears clinic, the tax, not the tax office, Medicare rings up, my client and says, you're doing too many pap smears. This is a female doctor. I mean, I was outraged and going, well, that's not your job to say that. And when I actually spoke to them, who are you, a doctor? No, this is from the Medicare office. No. Are you a lawyer? No. Well, who are you? Oh, we're accountants. I'm going, well, bugger off, right? That's not how it works. I mean, women don't just line up and want to pap smear last time I checked. And I've spent too hard because that was when there wasn't many female doctors back in the 90s. I spent too much effort trying to get this clinic up and running, and even the doctors laughed at me that I would never get a doctor who'd be dedicated in pap smears, and proved them wrong. But as soon as that audit happened, guess what? That service got shut down. So it's bothered me a lot about the role of government and what patients do and don't know. And particularly with COVID, I was very concerned about the gagging, where doctors were actually told, well, you're going to be engaging in an APRA breach if you start talking anything adverse. And I was in the media, saying, well, I think patients have a right to at least have a conversation. And then they even banned billing. So the patients couldn't even be billed, even if they wanted to pay for it themselves. I mean, those things really, I'm not an anti-vaxxer. I just said I wanted to ask because I had actually was on a particular drug, which, if you're on warfarin and all these sorts of things, you get blood clots and these things from AstraZeneca. And I was reading all the international reports and going, this could have an impact if I take this particular vaccination. And I just think patients have a right to talk freely with their doctors without the doctors fearing that they're basically going to be reported to APRA or be prosecuted by not able to have this sort of conversation in the consulting room. And I guess that's where my real passion is, in all honesty. I do all this other stuff to make a living, to do that, but I do a lot of not-for-profit work in this, what I call health and financial literacy side of things, so people can better contextualize and have a more practical approach to solving a lot of these so-called dilemmas. And the less politicized we see healthcare, I think the happier we're going to be. And I think the problem I think the medical profession gets caught in is they can be too political, that even the politicians don't believe them anymore. It's crying that you're poor and maybe you're not as poor. It's just you might not be as resourceful, you're wasting resources. I think you need to get that balance right, and people like yourselves play an important role in that. And I think if we get the calibration right, we do have a sustainable system. It's an excellent system. It's actually the world's best on sustainability. I've read Harvard reports and stuff, and I've got them all. We have some excellent opportunities that we could export to the world using the Australian model, and I mean that quite sincerely and quite genuinely. It would fix a lot of problems if people stop knocking what we haven't got or thinking it's better elsewhere. We're doing a lot of great things, and that's what I'm really keen on promoting. That, and we do that through our clients and people like yourself to sort of get the message out there. I think we are ready for a great big new boom, a new renaissance in healthcare. And I guess crises, as I say, never waste them. And we're not saying, well, now it's giving everybody a chance to take a breath, because now they're having to make big decisions. And I think these decisions, as bad as it might initially feel, with the correct vision, I think people are seeing a lot more opportunity than problems. And I think it's going to be very empowering for everyone, both patients, practitioners, and owners alike, once they kind of see what's really available out there and they're ready to listen, I guess, is the starting point.
You mentioned COVID, and I guess that challenging period of time. I guess every journey has its own challenges, ups and downs. I guess what were some of the toughest hurdles you faced, both personally and professionally?
Um, well, it's kind of weird because even though I'm based in Adelaide, I don't have offices around Australia. In fact, COVID was a boon because we were always working remotely, and people didn't like it. And we actually got more work out of it, not less, because suddenly everybody turned on Zoom and thought, oh, you can do business on Zoom. So it wasn't really a problem.
Well, world completely changed at that point in time. Everything,
Yeah,
yeah. Zoom's been around for years and years. Oh, we can turn
yeah.
on a camera.
So suddenly the world caught up with what we were doing. It's a bit like payroll tax, So yeah, that's right. You stay there, and I'll see you at the end. Eventually, our worlds will meet, is my view. Um, and so yeah, look, probably the worst thing was there was obviously a lot of fear. It's the reports that we were getting from receptionists, and not wanting to even come to work or being infected. There were doctors who just didn't want to come to work. And I was actually on the ABC 7:30 report I was interviewed on. This called Practice Collapses. Because basically, if you can't see patients, you're not billing, you're out of business, and that's what we saw. And this is just before they started putting in all these wonderful boost grants and all this other cool stuff. But yeah, and I think that was the hardest thing, because I think everybody, just that period of uncertainty scared everybody. I think it made everybody start to value a bit more about their life. And I think what really has become more tougher, to be quite honest, is there was a certain work ethic and a lot of things we could take for granted, their assumptions. And what happened is now everybody thinks, well, every decision I make, every breath I take is a life or death decision, even coming to work. What could else I be doing? Could I spend time with the kids? Could I spend my time reading a book? That now, when we used to say, oh, you got one doctor, and you could, I think the college reported this, they said, if you have overseas doctors, it's 0.9 FTEs, but, if you've got a non-overseas doctor, a local doctor, that's not an overseas doctor, it's 0.6. So everybody's gone very lifestyle orientated, and the business economics of general practice and the fact that people are stopping bulk billing and inflation that's sort of come out of that has been a bit of a challenge for everyone, not just for us. Because I feel, when you ask me what my challenges are, I see my challenges as being the practices challenges. Because if they're suffering, I'm suffering as far as I'm concerned, even though I might not be suffering financially or otherwise. I deeply empathise with them, so I'm speaking as from back of the front desk. and people are just becoming a lot more demanding about their rights and their obligations and what they're entitled to and what they can and can't be done. And I think that does create a bit of a them and us and a bit of a hostile kind of environment. And I know there's a lot of anxiety amongst practice managers and owners going, come on, man, I just want you to do, instead of one session a week, could you do two? And it's almost like pulling teeth. And it's really hard when you're trying to offer continuity of care, safe care, teamwork, and you're trying to sell all this really cool stuff, and people just simply say, meh, I don't have to, because I make enough money now that I can work part-time. And I'm a bit, and I'm sorry, I'm being controversial here. I don't think GPs are not being paid enough and they're doing other side hustles. I think the opposite's true, that they're making enough when you look at the rebates and how you can work the whole system, that they don't have to work full-time, right? And we've got empirical evidence that shows that. So they're just choosing not to come to work, right? And for most of us, once our bellies are full, why work more? I mean, my father, bless him, he was a psychiatrist, and I said, Dad, why do you only work half time? And he goes, because the other half goes to the tax man. I said,
His son became an accountant. Did you help him save his tax?
exactly. Yeah, I fell off my chair and said, okay, I give up. But that's, whether I like it or not, that's the reality, my friend. You know,
Death and
and I'm so,
taxes. I think
death and
that's
taxes, exactly.
death and taxes. Yeah.
And people will work to a certain level that meets their, day-to-day living needs and their retirement needs. Okay, and we've become, these are all lifestyle occupations now. They aren't vocations anymore, right? Um, I remember one male doctor said, I'll have what she's having. And I said, what's that? And she goes, the ability to say no. Because, I was talking to the female doctor, so could you work more past, 3 o'clock? And she goes, no, I've got to pick up the kids. And the male doctor looked at her with envy and goes, I just want to be like her. That's what women taught us. And so we live in a generation now where the work expectation and work-life balance is so primal, and it's been embedded. And all our business models and the economics of all of that has to change, and dramatically change. It needs to be incentivized. You can tax the crap out of everyone, Albo and and you can have all the audits, and people like me are going to be happy. We just love audits. Let's be honest. No accountant's going to complain about an audit. It's just more work for everyone, at least in our world. But I don't really think that's a good use of anyone's time, especially yours truly. But those sorts of, there are going to have to be other incentives, and practitioners are looking for it, where I can not just eat what I kill, but earn while I sleep. And I guess the innovative practices know how to do that, and are giving it a say, well, you can go from employee to entrepreneur, and here is a director pathway program, and that's what we do with our clients. So if you want to run a really great practice that's sustainable, and it might be slightly controversial here, it is probably important to have a clinical lead, a clinical owner, because generally doctors like to work with doctors, and they like to always see somebody who is a doctor that has some sort of oversight. It makes them feel safe. And and that can be a good or a bad thing, because just because you're a doctor doesn't mean you know how to run a practice or even balance a checkbook. Let's be honest. And that could cause more problems than solutions. And there are many excellent non-doctor owners out there. Excellent, superb. And I work with those people as well. But I think it's really important that, if, and I'm targeting general practice, I'm assuming that's your core constituents here. If GPs don't want to own their own practices and they don't take an active interest, that means they don't believe in their own profession, and they don't believe in their own profession's destiny. So then when you go and lecture the public on how things should be and ought to be, and you don't have any skin in the game, your credibility, your trust, your authenticity is really on question here. Because if you don't want to invest in yourself, you don't believe in yourself, then why should people believe in you? And so to me, I challenge everyone, particularly the practitioners that are listening, and it doesn't matter whether you're a GP, medical, dental, or health. If you become what I call very transactional in your thinking, you're doing more harm than good. You have a relationship with people in the community, and that is a responsibility that, it's a privilege. It's not a right, it's a privilege. And when you start to commoditize yourself, sell yourself off to a corporate and think this is all about money and it's about getting a bigger house or bigger than the other guys or FOMO and whatever, I think that's a very dangerous path that you set for yourself. And it's a very hard one to get out of, which is why you see all this problem with corporates and tax and all that. Because a lot of these problems, payroll tax and all that, came from the corporates. It didn't actually come from your traditional practices. And those, there have been good things that the corporates are doing on efficiency, effectiveness, but there's also many not good things that have come unintended consequences. I'm not saying all corporates are bad, don't get me wrong, but because there hasn't been this point of why are we all here, what's our ultimate purpose? And to me, if I'm a professional person, it's to educate first, right? Whether they're a client or not, whether they're paying or not, is to educate, which is why I'm talking here. We're not, this is all pro bono. There's no exchange of money going on here. There's no backdoor deals. We have a responsibility, those of us who are in the professions, lawyers, accountants, doctors, practice managers, to educate the community, educate our colleagues. So, and that's what's going to basically move us all forward, right? And I do find it slightly anathema when people just tear down other people, and we don't all get it right. I don't always get it right. And we shoot those important messages or not explaining ourselves. Or when somebody doesn't say something correctly, it's a really good opportunity to discuss and explain oneself to everyone, and then people can decide for themselves. Nobody's telling you what you got to do. We don't have to do. You can't force doctors to do anything. I've never said to people, tell your doctor to do something. All you can do is charge them a bit more. We've got a nudge pricing. So if they're always running late, you might be able to charge them a higher service fee just to get them to run on time. So they're not, your other doctors don't get upset and feel that they're subsidizing somebody else's practices that they might not all agree with. But if you build fair and equitable, open and transparent systems, both internally and externally, a lot of these problems that I keep hearing aren't really problems. It's just a lack of clear vision, a lack of clear focus, a clear strategy, and a clear operational focus on how to operationalize these things. Technology is key, and that's going to be the game changer. Those that get it and understand it and harness it, you can do more with less. I guarantee you. But you can't if you're not even prepared to consider it in the first instance.
I think the introduction, even though it's been there for a while, but AIs in terms of how that will benefit the practice in itself if it's used ethically and morally, that's going to be a game changer for, I guess, any industry, especially ours.
Look, I say to people all the time, losing somebody's trust is like losing your virginity. You ain't going to get it back. I'm sorry to be so clinical, but I want that to burn in people's minds, and I'm sorry if that upsets people and it's not correct or whatever. You need to live and breathe that. And if you can't be open and transparent, you're probably not doing something right. And maybe that's a starting point.
We could have used the reputation, analogy. You used to build the reputation, a second to destroy it instead, David.
I just want to keep it simple, but I totally agree. But that's too long and too wordy, But sometimes if you want to school somebody, you got to let everybody know. If the patient doesn't trust you, or the doctor doesn't trust you. You get a lot of people, exiting very, very, very quickly. So and this is why I'm very careful about the clients that I take on. Not every client I want. I go, well, are we okay here? Now, look, don't worry, I've worked for some interesting and questionable people in the past, right? And I'm always ready to listen to people from different walks. There's different circumstances people find themselves. Some of them quite famous, ended up in high court, who've since died, but at the time I trusted them on good faith. What we look for people is not what past sins you've done, but whether you can redeem yourself. Do you have a redeeming feature? And that comes from having the right attitude, basically. And that's what I probably look at. We can always change and rehabilitate people. I've got my belief that people can change, but you can't change somebody who basically only wants to listen to their own opinion and nobody else's. You can't change people who don't embrace the idea of being accountable to themselves and accountable to others. And you're better off letting them go, is what I would say to people. And it's my best bit of advice. Just cut them loose, because they're a negative cancer on the rest of the practice culture, and that's when these big problems start to happen very, very quickly. You can't hide bad news. It just gets worse with time.
I want to touch base on breaking the stigma here. So accountants are often stereotyped as just numbers focused. How do you challenge that perception and bring creativity and empathy to your role? Obviously there is that human side to our roles. How do you bring that yourself?
I think as accountants, I haven't been very good at marketing ourselves, so we're to blame, firstly. And we dumb it down because we make it look so easy, but it's actually very complicated because we have to deal with an array of laws. I've got a 10,000 page tax act that changes 1,000 pages a month, right? People don't see all that. They just see a bill, they see an invoice, and they don't know why. And for me, when I really reflect on why I want to be an accountant, I see accounting, and I work with a lot of interns in university. And I say, look, accountancy is life expressed in numbers. The numbers don't lie. If you make a good decision, your profits go up. You make a bad decision, you see a loss, right? If it's a really, really bad decision, you see all this debt, and it could take you another 5 years or 10 years to pay off, right? Every time you do your financial statements, you can't ride from that. And a lot of people, I call it financial infidelity. I had a lawyer, that friend of mine, who had that problem and wouldn't share it to his wife. And quite honestly, he was actually on the ethics board. And then one day he tapped me on the shoulder and he said, I went to kill myself. I went to jump in front of a train. And I said, what? Why? He goes, well, this whole thing about being a big time lawyer, I was working for the banks and all that, but my wife was spending all this money and I didn't want to show that I really couldn't afford our lifestyle. He went into debt. Yep, we went into debt and transferred money out of a trust account and got busted by the Law Society and got struck off. This happens in medical as well, my friend. This happens in all professions, my friend. Because we're too busy trying to impress people that we really don't like. And to me, I see money is a bit like getting on heroin, man. I'm the methadone program. Don't worry about your friends and don't worry about their holidays and their Facebook pictures. Turn it off if you can't handle it, right? That's the start point, right? Just focus on you first and focus on your family. Focus on what you actually need to pay the bills today and to retire comfortably tomorrow. That's what your main game is. You need about 2 million, 2 to 3 million. Okay. So I don't care what anybody says. You need accountants to explain that number to you. And if you don't, I've just given you the goddamn number. Now work backwards. Now I've given you the end game. So part of it is that accountants need to explain what's the end game, why you're actually hiring them, so you can get to that number. And taxes are just another overhead, right? You don't have to pay them if you know how to set yourself up properly. It's a choice. I mean, you still have to pay taxes, but you know what I mean. Some of us, most practitioners, I say, pay too much income tax. Every time I go and redo their books, I'm going, well, you've got to save here and here. Save $20,000 a year if you structure yourself properly. But they don't want to listen because they want to do it themselves. I think these are probably some key takeaways. Like I said, accountancy is life expressed in numbers. It really does give you the feedback on how you're going. And as much as you don't like your accountant, understand if you didn't have an accountant, they wouldn't collect the taxes that pays your Medicare bills, so you could tell everybody how much better you are. Because if you had to charge for your services, which most of them say they can't, well, who else is paying for it? It's the taxpayer. So we all need each other, okay? So a bit of mutual respect is probably a good starting point. And if you've really got a great accountant, they'll be able to explain those numbers to you, and don't always begrudge them for trying to help you. But one of the main reasons why people don't like spending money on accountants is a bit like visiting the dentist. And, they think it's intangible. But that's a problem for us. We don't educate people properly. And I think accounting is fascinating because, like somebody said, they find me, I don't mean to sound slightly creepy, but what we have to understand about money, and this is people don't understand about money, is that we all work very hard for it. And we're very careful with things that we work hard for. And I cannot help seeing on a credit card statement, if somebody's going to sit there and buy, I don't know, a Gucci watch, that automatically conveys a certain value proposition to that individual because they could have spent it on something else. So that's why I say it's accountancy's life expressed in numbers. I know who you are by just your spending habits. And whether that's on your practice or anything else you do, those numbers don't lie, because that's what you care about more, right? And there's nothing wrong with that. Nobody's judging you. You're entitled to work hard and enjoy yourself. But, at the end of the day, a good accountant actually understands, what your vices are as much as what your opportunities are, and your capacity to save and then create wealth creating opportunities like an energy income by owning a practice and running it well and encouraging others to buy in is probably the smartest thing you could do in this country, right? Because everybody's always going to need healthcare. And you don't always have to do the work. You can either you can either be the dog walker or you could actually be owning the dog business. Sorry to use it's a very bad analogy, but that's just what came to mind. And instead of earning $15 an hour, earn $10 an hour, but take on a bit of more responsibility. But if you know what the risks are, Those risks are less if you've got an open mind, but they're quite high if you're cavalier and you think, you can just cut corners and that she'll be right. And often what we have seen and why corporatization has happened in this country is people didn't want to go through those details, found it all too hard, and said, look, I need somebody else to run my business for me. Well, you've got, back in the day, you went to a corporate and they offered all this money up front, which is a bit like taking out a loan and paying it back over 5 years because they had all these T's and C's attached to it. But people like yourself and I say, well, you can have the benefits of maybe a corporate environment, but not be a corporate where you can come in and people can do all that technical stuff that you don't want to invest in high-end staff to do because it's hard to recruit, and have a user pay system there. And so you get the best of both worlds and you don't lose your clinical independence or your sovereignty. The world, there's so much more people can do now as a practitioner that they weren't able to do, and so easily as picking up the phone or getting onto the internet and getting access to an amazing set of resources. So I think really,
So many people out there that in terms of their resources and their knowledge that they can provide value.
yeah,
So in terms of capitalizing on that in itself as well, and working
yeah,
together through partnership and
yeah,
collaboration.
absolutely. And it's more at an instant. So a lot of these things that everybody's panicking about, I don't understand what they're panicking about, except they're probably talking to the wrong people.
Yeah,
I'm sorry,
totally.
I'm just being really simple about it. I'm sorry. Just use Perplexity, Google it. If you think I'm a charlatan, Google my name. Put in Tenet Docs if you think that's it. Google it. Google it all comes up now at your fingertips. It's all cited. It's all wonderfully referenced. The world isn't as scary as it seems. What's scary is the apathy. What's scary is, well, I can't do anything. And work with people who are really focused and really energetic and see the opportunity. That's probably what I do. It's the company you keep that's going to make you successful. Don't hang around those negative people.
Completely agree. You've been in the industry for so long now. In terms of the legacy you want to leave behind in the healthcare industry, both financially as a financial expert and as a human, what do you want to leave behind?
Um, I want people, every member of the community anywhere in the world, to feel really self-empowered. That's how I'd like to leave them. And feeling that they're informed, they're getting the right type of care on time, and it's high quality, that they can trust their doctors, they can trust their systems, that nobody has to think twice. And they can assume, which totally contradicts everything I've just said. And that's the way it should be when it comes to healthcare. That's what should happen when you're feeling vulnerable. You shouldn't have to second guess anyone or anything in the system. And nobody should be in a position where they feel like they've been taken advantage of. Well, use this drug or whatever it is, and not feel that they've had that informed consent. So really, what I'm looking for is people to feel that they've got they're financially and health literate, and they're self-empowered, and that they can pass it on to the next generation, and become productive and useful members of society. That's what I really want for people. And whatever we are doing here, and we channel that through the GPs because they're the ones that have the most contact with society, that they're the ones that are going to be passing on that message with the work that we do. Because when you're in trouble and you're in a darkest moment, you don't necessarily go to your mother or your father. You end up going to your GP. And you can't hide all those things. And I want those GPs to be totally empowered to be able to deal with all of those issues and acquit them quickly and timely, and so people feel safe. Okay, everybody has a right to feel safe with their professional advisors that they can trust. And I guess what we want to do is empower both the practitioners and the patients to always feel like that, not sometimes feel like that. It's a hit or miss job. And lift that overall standard. And for the profession, I know they demand respect, but you can't demand respect from people. You have to earn it. And having peer-reviewed healthcare standards, which don't exist in the world, commonly agreed peer-reviewed standards, is the biggest missing link in fixing healthcare. And this is why we've set up this International Healthcare Standards and Ethics Board. And until you do that, like the accounting profession does and the aviation industry does, we're not going to fix healthcare. So I would like the doctors to take up some ownership on that narrative and not just talk about money, and just talk about, well, how do we define high quality healthcare, put it in writing for the world to see, Not say it's hard, it's impossible. I've got academic professors who agree with me, so I'm not alone when I say this. And these are international professors. There is a way to do it. The accountants have done it. We've achieved that goal. And it's not as hard as you think. So it is hard if you keep your head in the sand. So hopefully what I hope to leave a legacy is that we are starting to pull our head out of the sand. And that's starting with the medical and healthcare profession at large.
I want to dive just lastly on your personal reflection. Looking back on your journey, what advice would you give to your younger self?
You're going to have one hell of a wild ride. You're going to meet people. Some of my clients work for the Queen, or had worked for the Queen, now the King, and best friend. If somebody told me that's the kind of work, and I've got, I don't know, Prince Charles's mobile number on my phone, man, I'd say you're on drugs or something. I've had a remarkable life, and a very really good one. I've met all these, with the prime ministers and stuff, and I've been able to have one-on-one chats and wonderful people on the ground. It's not just people with big names and titles and statuses, but people have really changed the world. I mean, I'm working with the Google Maps founder, on the healthcare project, Stephen Ma, which you would have seen in the Guardian's 20-year anniversary. I've had a very, very excellent life and opportunity, but it hasn't come easy. It's come from being curious. It's become from being persistent. And I don't say that to being arrogant, but I've been on a constant learning journey. And so I would actually say to myself, you're not going to like it. You're going to have a lot of skinny financial times, and it's going to hurt, and it's going to put a lot of pressure on you. But you're onto something really big and something great that everybody else will hopefully one day see, and just stick at it. And I'm sorry, it's going to be a very painful journey, but that is part of the process. If you're trying to go from good to great, it's not going to be something that's going to be easy. And that's what I've kind of learned from myself. And it's a real privilege to work in this industry to this day, and it will be until I got a foot in the grave. And hopefully I can leave that for another generation of young people like yourselves to maybe take over, because I can't do this. I'm going to one day leave this planet, and I want to leave in a better place than I found it. And I guess that's been I know that's a bit cliche, people say that, but that's generally been my calling after the accident. That's what I've been committed to. So I've unfortunately been set on a one-track mode, and I haven't veered. It's very focused, and I hopefully that will continue. And we'll land a few permanent punches into the ground before I make my own dent in there.
And just finally, outside of work, I guess, we've spoken a lot about, we're very privileged to work in our industry, I see. But outside of work, what brings you joy? What keeps you grounded?
God, it's hard. I mean, my work is my grounding. I don't know what the work. I don't have this line like everybody has. My life is my work. What keeps me grounded is when the one person says thank you. What keeps me grounded when somebody rings me up like you and says, "Hey, why don't you tell your story?" I know it sounds stupid, but you got to understand where I'm coming from here. Right? Probably 99% of the time, it's just people just getting upset as soon as you say something, for no, without wanting to dig any deeper. So I guess these sorts of moments are probably really important moments, and I think everybody needs a Joe Rogan moment like we're having here, to tell their story. I think that's really important. And but look, every time I feel that we see a well-run practice, and I know because when I drive and fly around the country, I do know the practices and who our clients are, and I can literally tell my kids, "Yep, that's one of ours. That's one of ours. One of ours." That is a very proud moment. And said, "You know what? We kept services in that rural town going." And that makes me feel pretty cool because that's going to be there forever and a day. And we've done that without doing any funny skullduggery or anything else like that. And we did it ethically, and that made the BRW fastest, 100. Why is that important? Because people hopefully will copy those practices and do even better than themselves, whether they're a client or not, doesn't matter. And I tell you, that makes me feel really, really good because I know then we're really making a really big impact. If some of that culture, some of that ethos is being imparted in those practices, and I love them growing and going from 3 doctors to 30, wherever they are, simply because somebody decided they were going to pen a vision for their community, for their clinicians, and and really grow the towns. And these general practices do grow towns. I know, because I talk to the mining companies and they say, we need this. And if we don't get doctors in here, we don't have a mine. It's a very important ecosystem. And people say, why do you spend so much time on GPs? Because they're probably the most important people. No, they are the most important people in our entire healthcare system. And if they're doing their jobs well, you don't need big hospitals. You focus on these guys, and you'll get a lot more done, a lot quicker. So I'm very, very passionate about achieving success for our clients. And every time I see them doing well, whether they're a client or not later, I'm very much internally proud and happy that we've made a long-term and permanent difference into that community, and we can only hope that they can self-replicate that for themselves and for others, that join them.
That's absolutely awesome, because that was actually one of my defining moments, the domino effect that it has by working, for our members. General practices, with the doctors, the people that work at the general clinic, the community in itself, it's a multiplier effect. So no, that's awesome.
Totally.
Thank you very much, David. It's been an absolute pleasure having you on the Behind the Practice podcast, sharing your insights, your journey, your wisdom. I really appreciate it.
That's right. Take care, and remember to always practice kindness and gratitude.
Thank you, David.
All right. Bye.